Hello, my name is Amy Polen. I am from the University of South Florida's College of Public Health, and thank you so much for dropping into this virtual poster presentation for the 2021 Natural Hazard Center workshop. I'm just going to be talking over a little bit of research that me and my colleagues have been doing on the effects of the COVID-19 pandemic on hurricane evacuations in Puerto Rico and the U.S. Virgin Islands. So just to start, as we're all pretty familiar with at this point, the COVID-19 pandemic has had a profound impact on all aspects of society and has created an unprecedented compounding public health risk. And this is especially true during the 2020 hurricane season, when emergency managers were just starting to balance the new normal and the risks of having people leave for a hurricane, but also trying to minimize exposure to COVID-19. The pandemic increases this complexity of planning for hurricanes because the human mobility and congregation typically needed for hurricane evacuations and sheltering is in direct conflict with the social distancing needs of the pandemic. Puerto Rico and the U.S. Virgin Islands are especially vulnerable due to a high incidence of compounding hazards resulting from hurricanes, including landslides and flooding. These physical hazards can cause infrastructural damage to systems such as healthcare, limited mobility on roadways, limiting the response and recovery segments of a hurricane event, and widespread power outages that can result in cascading public health crises across the region. Additionally, Puerto Rico and the USVI have a high incidence of social vulnerability, as about a quarter of the USVI and about half of residents in Puerto Rico live in poverty. Having tangible resources and social and economic support has been shown through previous research to be a pretty good indicator of success during hurricane preparedness, response, and recovery for a community and for the individual. So the problem posed that we're trying to tackle with this research is that should a major hurricane occur in the Puerto Rico, U.S. Virgin Islands region during the pandemic, residents would be forced to make complex decisions as they balance their personal risk of infection against their need to evacuate the area. And the goal was to ascertain specific factors that affected residents' intended evacuation decisions and how COVID-19 may play a role in that decision. So the study area was Puerto Rico and the U.S. Virgin Islands. The survey was conducted digitally to any residents in Puerto Rico or the USVI that were over the age of 18. It consisted of about 70 questions that included questions on demographics, characteristics of their household, potential sources of information they relied on, their pre-existing health conditions, and a series of Likert scale questions designed by the research team that assessed an individual's perceptions of risk regarding sheltering in place, going to a public shelter, or evacuating the area when considering the compounding hazards found in the 2020 hurricane season. It was distributed in 3 languages, English, Spanish, and Creole. The sample was obtained through convenience and snowball sampling using the research team's professional networks, who would then distribute it on their websites, email list, and social media pages to people within their constituencies. This was done for instance, using advertisements such as this one shown here. As well, during the latter half of our surveying, we wanted to focus on vulnerable areas, so doing a hotspot analysis using the CDC SVI data, it was found that the western side of Puerto Rico was significantly more vulnerable than the rest of the main island there. So we decided to do targeted Facebook ads such as the one I just showed you, specifically in this region to make sure that those who are the most vulnerable were represented in our sample. So looking at the overall results, we had about 450 responses, with the majority of them being from Puerto Rico. The average age was about 55, with 76% of the respondents being female. The socioeconomic status of the sample was high, with over half of the sample earning a college degree and having an average income between $50,000 and $59,000. Generalization of these results as such may not be applicable to the entire population of Puerto Rico and the USVI, as it differed pretty drastically from the census results to this region. So just regarding evacuation decision making, it was found that the majority of sample, about 60%, would not evacuate for an impending severe hurricane, and only 14% would utilize a public shelter. This is drastically different from other research done by Morrow and Gladwin in 2014 in the region that found that about 68% of Puerto Rican residents and 61% of residents in the USVI would evacuate for a major storm, compared to the 60% that we found that would not evacuate for a major storm. And that 22% of people in Puerto Rico and 29% in the USVI would utilize public sheltering, compared to our 14.2% that we found in our survey sample. For alternate shelter options, the majority of people identified that they could stay with friends or family in the case of a hurricane, and instead of going to a physical public shelter. Regarding future evacuation expectations, many of the people that we surveyed found that if the phrase advised versus ordered for a hurricane, if in hurricane communications they use the word ordered to evacuate for a hurricane instead of advised, they would be much more likely to evacuate. As well, we found that about a quarter of individuals found that it was very difficult to leave their home if they needed to evacuate themselves, and that another, about 50% of the sample, found that it would be somewhat difficult of a task, kind of hinting at the potential barriers to evacuation and limits that people may have in the evacuation process that could be addressed by emergency managers. So building off of that idea, we looked into aids and barriers to evacuation. So when we asked what would make it easier to evacuate, individuals most often said that better transportation to a shelter or outside of their area effect would make it easier for them to evacuate, and better communications about shelter and evacuation information, especially if that included COVID-19 information, would be incredibly helpful in making the process easier. When asked about their barriers to evacuation, many people identified a lack of information being a barrier, and as well they identified limits with transportation being a barrier and limitations with their pets. Of interest is that very few individuals identified COVID-19 as a barrier to evacuating, despite this being a pretty common theme that individuals found that COVID-19 would change their evacuation decision making, especially regarding public shelters. So it is interesting to see that they didn't necessarily consider it a barrier to evacuation decisions. Continuing off this theme, just talking a little bit about the results specific to COVID-19 and public shelter perceptions, over half of the sample considered themselves at greater risk and vulnerable to COVID-19 illness due to existing health reasons. There was a statistically significant difference in an individual's decision to use a public shelter before and then during the COVID-19 pandemic, determined through a McNamar's test. And about 18.6% of individuals that would have previously used a shelter would not have used the shelter during the COVID-19 pandemic, which is a pretty significant drop. So going off of this theme of less shelter usage, to kind of delve into that idea of why aren't people using public shelters, we posed them with Likert-style questions that I have here. And with the statement presented, if my only option was to evacuate to a shelter in my area, I would rather shelter in place than risk being exposed to the potentially large groups inside of a shelter. A little bit under 90% of individuals said that that was probably true or definitely true, indicating that individuals didn't think that the risks of being exposed to this large group in a shelter was worth it. Additionally, going down to the third point on the screen right now, when posed with the statement, I think if I went to a disaster shelter during a hurricane, authorities would have adequate safeguards in place to prevent the spread of COVID-19 in the facility. About 49% of individuals found that the statement was false, indicating a mistrust in authorities to actually protect them in the situation of a public shelter. And finally, when presented with a statement, if I was advised to leave my house during a hurricane evacuation, I think the risks of being in a disaster shelter during the COVID-19 pandemic would be worse than staying at home and enduring the risk of a hurricane. And an overwhelming almost 75% of individuals found this to be true, which is a startling fact, as that they would rather endure the risk of a hurricane than potentially risk COVID-19 infection within a disaster shelter. So just to conclude, the COVID-19 pandemic has had a profound effect on how people make their decisions to evacuate. Individuals now have a negative shelter perception during the pandemic and do not have much trust in shelters' abilities to protect them during the COVID-19 pandemic. There is room for improvement found in the aids and barriers section in ensuring equitable hurricane preparedness for all individuals, And this can be achieved by addressing the most commonly mentioned barriers to evacuation, which included a lack of easily obtained evacuation and shelter information and limitations regarding transportation. By emergency managers communicating shelter risks and proper shelter information regarding COVID-19, or in any case of a future pandemic, individuals may be able to better trust authorities on their ability to protect them in the case of shelters because it will be less ambiguous, as well as just having the information to make a proper evacuation decision will help the public. So just regarding next steps with this research, a survey has been conducted for 2021 with questions on vaccination status's influence on evacuation decision making. So if someone is vaccinated or not, would that also affect their evacuation decision? And if you are interested in keeping up with this research, I have included a link on the PDF that links directly to our Design Safe page, which we will be updating in the future as more reports come out regarding the 2020 and 2021 survey data that we have been gathering. And again, I would like to thank everyone who came in and dropped into this presentation, as well as the Natural Hazard Center, the rest of my research team, and anyone else mentioned here in the acknowledgements. Thank you so much for coming. Have a good day.